Okay, Mom, I appreciate you agreeing to a quick interview here. Can you tell us about symptoms and your concerns for you and the baby both before diagnosis and then the release for the tongue and lip and cheeks?
Yeah, she was having a really hard time breastfeeding. She would chomp down instead of really suck, and she would just fall asleep in like 10 minutes, and I didn't know that. I thought she was done, but really she was wearing herself out, and she would fall asleep, and then she wasn't gaining enough weight, and she also only would look to the left when she was sleeping, and she wouldn't look to the right, and those were the main symptoms that I saw.
For her, were you experiencing any pain or any symptoms?
Oh yeah, I had a lot of pain during breastfeeding, and just a lot of soreness, and it was not good.
Not a good experience. No. And a lot of pain for you too.
Yeah.
Was she colicky, reflux, anything like that?
Not really any reflux or anything like that, no.
Alrighty. Do you think that's because she wasn't getting enough to even have that issue?
She is spitting up a little bit more now, so I know she's getting more food.
Okay, alright, so she is starting to have that a little bit.
Yeah.
How have things changed other than that? How have things changed for you and for her both?
Oh, she's eating so much better. We just got her weighed, and she's over a pound over her birth weight, which is amazing because we were trying to get her up to her birth weight.
Right. And we're just 10 days maybe since the procedure,
yes,
correct?
Yes,
okay.
yeah.
So she's gained over a pound in just 10 days?
Yes.
Okay,
yep.
Great.
Yep.
That's great. And how are you feeling?
Oh, a lot better. Breastfeeding's definitely gotten better. We're still working at it, but it's improved immensely. Yes.
Okay, great. And you're doing some body work too, correct?
Yes, we had her adjusted multiple times, and the chiropractor said that she can already tell her jaw is so much better and better aligned, and she was tight on one side, and she's loosening up more, and so it's a lot better. Yeah.
Okay, so good. Even overall body improvements
yes,
then.
Yeah.
Okay, great. What about the stretches? Any thoughts on that? Because that's always everyone's biggest complaint and challenge, and their worry.
They take a lot of time, but well, they're actually not too bad. They're really short, but it's just remembering to do them every few hours is the main issue. And she doesn't like them, but after a minute or so, she's fine.
Okay, alrighty. Did you ask for any help from anyone before you saw us?
Yeah.
How did you what was your experience of transitioning through medical specialties to try to get to where you are now?
Yeah, we were going to the chiropractor beforehand, and I went to see a lactation consultant to try to get some help, and they both were saying that she had a tongue tie, and that's one of the issues, and they recommended to get it done for sure, but I was hesitant.
Mm-hmm.
So
yeah, that's understandable. How about any pediatricians or OB-GYNs or anybody like that?
No.
Had you asked anybody or any of them?
Okay.
No,
I didn't.
Alrighty. What have you done for pain control for you and baby both?
We got the rescue remedy for kids, and we're giving her that when we could tell she was really sore, and a little bit of baby Tylenol.
Okay.
And we did use we froze the breast milk onto like a sheet and gave her little chips of that to help also.
Okay,
yeah.
Good. So you put breast milk, the frozen breast milk, straight onto the wounds to help with that. Did you try that before the stretches like we had talked about a little bit?
Yeah, that seems to help.
Seems to help. Okay, very good, very good. Any advice for parents or tips that you can think of that you want to mention?
It's definitely worth it. We weren't sure if we wanted to do it, and I'm really glad we did. It's not as bad as it seems.
Right. Okay, good. And it's been an improvement for you and for her, so that it's made it worth it.
Great improvement, yes.
Okay.
Yeah.
Well, great. Well, I appreciate you sharing your experience. Thank you so much.
Thanks.